My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about thyroid Hashimoto's, the worst case I ever saw. You see, I've been practicing for over 30 years now with chiropractic, functional medicine, nutrition, and a lot of patients come in with thyroid issues, autoimmune, nodules. It's one of the more common things that patients come in with. And it may have something to do with that I also had Hashimoto's over 10 years ago. And after a lot of investigation and figuring out, I was able to figure out what was causing it and actually heal myself. So in the process, just learned how to apply that with other patients. So this one particular patient came in over 10 years ago, and she was the craziest symptom. I mean, she had stinging, numbing, shooting pain, like pinprick pains all over her body. It would wake her up at night. Fatigue, brain fog, digestive issues. She had constipation. I mean, severe constipation, thinning hair, dry skin, aches and pains. She had high cholesterol, and her doctors wanted to put her on statin drugs. And actually, low thyroid can cause all of these things, including high cholesterol. Insomnia, anxiety from all this stuff. She wasn't sleeping. She couldn't think straight. So she had been to a number of different doctors. They prescribed, they diagnosed her as idiopathic peripheral neuropathy. They had no idea what caused it. Prescribed her some this powerful nerve drug that she took it once, ended up in the emergency room. I mean, it just wasn't good. So in the process, so I did initial evaluation, found out she had Hashimoto's. Her antibodies were over 5,000. So really under normal 100, below 100. So her thyroid globulin antibodies were over around 5,500, and the other antibodies, TPO, were almost 300, and that should be well, depending on the lab, that should be under 50, depending on the lab value, which lab you're using. But anyway, so over 5,000 antibodies were, and so I sent her to an endocrinologist at the time, and she prescribed Synthroid and said, "Oh, it's just going to continue to get worse. Your thyroid will continue to deteriorate, maybe go high, low, develop nodules, goiter maybe," and it didn't paint a very rosy picture. So she was really frustrated and still feeling terrible. I mean, so around this time, I also coincidentally found out I had Hashimoto's a little before that. So I was doing a lot of research and investigating and figuring out what caused it, because I couldn't take for an answer like the endocrinologist told me that there's nothing you can do about it. You just have to take Synthroid the rest of your life. So in the process, I realized that chronic health conditions, whether it's whether you have an autoimmune condition, whether it's Hashimoto's, which is autoimmune thyroid, any really chronic health condition is caused by three main things: physical, mental, and chemical stress. So as far as physical stress goes, she did have a lot of neck issues that we were helping her with. As far as mental stress, yes, after testing, she did have adrenal dysfunction, adrenal fatigue. So that was part of it. Chemical stress. So that I after doing analysis, lab work, figuring out what was going on, it basically breaks down into four main parts under chemical stress. So the first is deficiencies. So So your body, so autoimmune conditions, there's an underlying thing, whether you have rheumatoid arthritis, MS, diabetes type 1, I mean, lupus, Hashimoto's. Your body is attacking itself. So whatever body part that is, whether it's thyroid, joints, whatever, nerves. So, but why is your body attacking itself? I don't take it that it's just a deficiency of prednisone or deficiency of these other drugs that they want to just keep giving you and not giving you answers. So it's finding out, well, what is it that the body is, fighting off? So, well, one, if you're deficient in certain things, your body isn't functioning properly. Like, for instance, this patient was deficient in vitamin D, magnesium, B12, iron, and iodine. So take iodine. If you're deficient in iodine, then that affects your thyroid. You need iodine to make thyroid hormone. And if you're deficient in iodine, that can cause nodules and goiter. And you shouldn't just go and take iodine if you haven't tested for it, because you can also be too high, and that can cause more harm than good. But in her case, she was deficient in that, again, along with iron, B12, magnesium, D. So all these things are very important in getting your body to function at a normal level. Your immune system, because that's really what's going on with autoimmune, your immune system's going haywire. So that's number one, deficiencies. Two, toxins. So she was high in lead and mercury. And both of those are actually nerve toxins. They affect your brain, nervous system, amongst many other things. So this peripheral neuropathy that she was having, that was part of the equation. In addition to the deficiencies, pathogens. So pathogens are extremely important, and from my experience, almost always involved with autoimmune conditions. So you have, so she had really high levels of yeast. She had multiple parasites. She had bacterial overgrowth. Now all of this can cause leaky gut, which then increases the amount of food reactions, which leads to the fourth thing, under chemical stress, are food sensitivities, food reactions, food allergies. And in her case, she was sensitive to gluten, yeast, sugar, legumes, dairy, eggs, and some others. Now, if you're eating, and if you're eating foods you're reacting to, gluten, for instance, and if that's an issue, then your body's fighting this off and attacking. Your immune system sees it as a foreign invader, and then in the case of Hashimoto's, can actually start attacking the thyroid while it's attacking this gluten molecule. So I almost always find gluten and yeast involved with Hashimoto's. So after, like I said, testing is what we found with her, and it was very similar with my case. So what I did for myself and many other patients since is, I realized that gluten-free diets just didn't work, because you're eating all these other gluten-free products with rice and rice flour, and there could be corn flour and all these other, you can go out and buy gluten-free donuts and gluten-free cakes and cookies. It just doesn't work. So what I found is a diet that did work is a diet that's not only free of gluten, but free of gluten, grains, sugar, yeast, soy, dairy, eggs, legumes, and so on. And for phase one, because you're eliminating those most common foods that are most responsible for digestive and other chronic health issues, and allows your body to heal, calm the inflammation, and actually get better. So again, I call it the free diet. That's what I followed this patient I'm talking about, and we're going to put a link to that phase 1 of the free diet. If you'd like a copy below, you can just feel free to click on that. So after doing all this testing and putting it through our treatment plan, which has since evolved, which I call our Functional and Free program, because it really is designed to discover your underlying root causes and provide long-term permanent solutions. So the over time of following this, and it was a you know, an involved process, because we had the food reactions, we had the pathogens, you know, yeast, multiple parasites, bacterial overgrowth, heavy metals. But over time, she started to get better. Symptoms started to go away. I mean, at one point, she had constipation so badly, she did not have a bowel movement for 2 weeks, like none, zero. For 2 weeks, like, where is this stuff going? And then, so she was coming in, we were doing all kinds of things, and finally she started going. It wasn't until finally, because her doctor endocrinologist had refused to give her anything but Centauri. So I'm like, will you just please, you know, ask her again to get you on like a WP thyroid, which is natural T3, and well, natural T4 with T3, because a lot of people can convert, they're low in T3, and that can cause a lot of symptoms like constipation and etc. So she finally did, and that, you know, that was a trick. As far as the constipation goes, that cleared up. I mean, she goes every day. So that's important too, to get, if you need medication, to get on the right one. Speaking of deficiencies, in her case, the T3 was still really low. So after all of this, again, the diet, the supplements, you know, going through our 7-step process, you know, our antibodies started to come down. They were, again, over 5,000, came down initially to, it came down to like 4,400. And then when we, then when we put everything together, like we just started doing one thing at a time, just came down, like I said, around, well, 1,000 points, which is pretty good. And that was in like 2 years' time. But then over the next 2 years, after doing all of this, it went from 4,400 to 114. You know, from over 4,000 to around 100, to like normal levels in 2 years. So it was amazing to see that transformation, and she was feeling great. Her symptoms had cleared up. You know, all of her, you know, labs looked good. Her symptom, stinging, all that stuff, aches and pains, the cholesterol went down to normal. So all of her issues had cleared up, and it's just so encouraging, you know, even a very severe case like that, to know that, you know, whatever it is that is going on with you, in most cases, you know, you can get better. It's just a matter of really committing, getting in there and finding out, you know, what's causing this, getting to the root cause, and then being provided with some long-term permanent solutions so that you can get better. So I wanted to share that story with you today, and thanks so much for joining me. If you would like a copy of the free diet, just click on the link below. You know, and if you know anyone that would benefit from this, feel free to share it. And again, I appreciate you spending time with me today, and we will see you next time. Take care.